Okay, well, hopefully I don't resemble the remark of our our program today, because we're going to be learning all about parasites.
Yeah, look, everyone thinks that, we live in a good country, Australia, like we're very clean, very hygienic, that how could we possibly have any sort of gut parasites or concerns? But that's what we're going to be talking about today, how it can definitely happen and how it actually affects quite a large percentage of the population.
Great, so I need some soap for the inside as well. Mullen, Peter, you have a very continuous habit of just freaking me out week after week after week. Today, no exception. We're talking about parasites.
Well, look, it's one of those things, as I was saying before, that we don't always give second thought. Like, we've talked a lot in this program about the importance of having a healthy gut flora. More good bugs than bad bugs. The good bugs help to keep yeast and bad bacteria in check, but they also may help to play a big role in keeping the gut environment healthy, so we don't get parasites.
Okay, so parasites in general, how do they enter our body? So we think we've got a gut up, but they just come in anyway.
Well, we're constantly in contact with sources of parasites every day.
We are still talking about microscopic organisms, not people,
right?
We're
talking about a range of things. We're talking about worms.
Oh, yeah. Okay.
And, worms are very common. And, things like worms, like we may get through undercooked meat or through our food. We're also talking about bugs like malaria is classed as a parasite. So worldwide, it's a massive problem still for a lot of communities. We're talking about Giardia. So Giardia, when there'll be outbreaks of diarrhea.
Okay.
Like
we're off on a good start,
in schools and daycare centres and aged care centres, Giardia, like a few years ago, there was an overgrowth of cryptosporidium in the water supply in Sydney.
It certainly was, about a decade ago from memory.
Yeah, so that was, the balance wasn't right, so these parasites were in the water supply, and a lot of people, but interestingly, so you can all be exposed. We could all drink a glass with that bad parasite in it, but you two might get really sick and I wouldn't, because my gut flora is really healthy.
I like how, Peter, you're shaping yourself up as I'm the healthy person. I'll be okay.
Absolutely.
Have a look at you.
Yeah, so we come in contact with parasites all the time. Blastocystis is another one. Now, blastocystis is a gut parasite that not a lot of research is known about it, but it's actually been linked to thyroid disorders. So for people that have an underactive thyroid and possibly even autoimmune, they also may have a blastocystis infection or overgrowth in their gut.
And that may be what's causing the thyroid.
It may be a trigger, may have been a trigger for their thyroid condition.
Oh, wow.
Yeah, so we're finding more and more about how these parasites may be linked to other things. And interestingly, some parasites, such certain types of worms particularly, there's been studies done where people have ingested the eggs or the basically like worm eggs, and the eggs would implant in the gut and grow. And by doing so, they'd cause the immune systems to switch from inflammatory to pro-inflammatory. So they found, for some people with inflammatory conditions like rheumatoid arthritis or severe autoimmune conditions, that these parasites might actually trick the immune system into sort of switching around. So we don't, I don't think all parasites are bad. I think they're a part of our environment and we live with them rather than have to think that we've got to kill everything that goes on. But certain nasty ones definitely can contribute to symptoms like chronic fatigue, irritable bowel syndrome. There's been links with conditions like ulcerative colitis and certain gut parasites. So it is important, if you've got a serious health issue and you've got a lot of gut issues that run alongside, I would always recommend getting tested for parasites. And we'll talk more about that in the third section about how to test for.
Now, it is very easy to pass them along, even though you might not know that you've got some really bad nasties in there. It's just easy to pass them on to the next person, isn't it?
Yep. So parasites can enter through our mouth or our skin. You can even get some parasites through the bottom of your foot.
Is that right?
Yeah.
How does that happen?
I don't know. I think that would be a pretty nasty bug, maybe if you were in Africa or somewhere like that. Water. So water's a big one, and not just for travellers. Like everybody knows, when you go overseas, you're best to try and drink bottled water, which again is not great because of other reasons.
But if you're doing it for that short term, couple of weeks, couple of months while you're away, that's better of the two evils.
And even things like if you go out somewhere in a country where you're a bit concerned about their water supply, and you maybe be drinking bottled water and brushing your teeth with bottled water, but you might have a nice big salad.
And which has been washed in the water.
The local water. So you have to be careful. Undercooked meat, unclean or contaminated fruits and veggies, handling animals, and then, overseas. Ice is the other big one. You go overseas and you're sort of out somewhere and you're being really careful with all your bottled water, but then you have a nice cold beverage of some description and they whack a bit of ice in it, and the ice might have been just straight from tap water or whatever.
And there's also a good chance that someone's just reefed it out of the bucket with their fingers and thrown it in the glass
absolutely.
as well.
So once you're infected with a parasite, as we said, it's very easy to pass it along if you don't wash your hands after going to the bathroom. You can easily pass on microscopic parasite eggs on anything you touch: door handles, keyboards, phones, etc.
Yeah, that's a big one, isn't it? People I still cannot believe that people don't wash their hands when they make a visit to the bathroom. I don't get it.
Yeah, we were talking about that a few weeks.
Yeah, we were.
Maybe that needs to be a name and shame thing.
Well, there's nobody here that I can think of. So we share a building with a lot of other people. We share the bathroom facilities, and quite often you'll be there and you'll see somebody walk out and be like, "Hang on, I didn't see you wash. What's going on there?"
Yeah.
But and sometimes I like to sort of trail behind someone exiting, so I don't have to touch the doors.
Yeah, I know
I
about
time my exit with somebody else's.
We know about your germ phobia, but that's okay.
It's widely spread, yeah. Stop looking at your notes, Peter. You should have all this stuff ready. I can have your notes because I don't know this stuff. You should have it all on tap on the brain. Look, we're talking parasites today, and the next, you've got a bit of a list of some of those things that you can tell if you have a parasite, can't we?
Well, look, Mark, we do, and Rob and I were just discussing in the break while you were out of the room that this list of symptoms could almost pass as in a loving way as a bit of a bio for your new dating agency.
Oh, you say this every week. It's not happening, Peter. I'm not allowing you to do this. You're not setting up a dating profile.
I'm thinking of holding an event in my rooms, actually.
Is that right?
In my healing rooms.
Okay.
And actually get you to come over and people can come to the practice and actually meet you just for, we'll do a speed dating thing. Maybe 3 minutes, or is that too long?
They can heal a broken heart.
They can heal a broken heart.
You obviously want nobody turning up at your practice because you'll lose people straight away, particularly if they're watching.
Just let Rob and I work out the details. We'll get back to you about that.
Okay. But these are the things that you may have a parasite if you've got these
Absolutely.
things.
So 10 signs, not to be mixed up with your bio. Unexplained IBS. People that have travelled internationally and got traveller's diarrhea. And actually, that's a pretty common thing that patients will come and see me where their digestion's been fine for years and then they've gone to overseas. We won't mention any countries by name in case they're represented.
Not Australia.
Not in Australia. And it's where they've gotten sick while they're on holidays and maybe come home, been sick for a little while. And interestingly, a lot of these parasites will have a cycle of 3 weeks or 6 weeks. So it might be every 3 weeks you might get a couple of days of where your digestion plays up and then it seems to come good, or even a 6-week cycle. So this is for people that have never been well since they've been overseas. History of food poisoning and digestion has not been the same since. Trouble falling asleep, or waking up multiple times during the night.
That actually does fit my profile, just between you and me.
Well, do you grind your teeth at the night time?
No.
Well,
I've never heard it happen, put it that way.
It's a common sign in kids, actually, that when they've got worms, they tend to grind their teeth of a night time, and mum will go in the morning and the sheets are everywhere and, the kids have slept really restlessly. It can be a sign of irritation.
Okay.
It can be associated with things like pain or ache in muscles and joints, fatigue, exhaustion, never satisfied or full after meals. And often one of the early signs or one of the chronic signs is diagnosed with an iron deficiency because the parasites tend to take up the iron for themselves.
So how would we know if we are deficient in iron?
Blood test.
Blood test? Okay.
Yep. Blood test. Interestingly, getting your full iron studies test done and monitored on a regular basis is one of the best tests for seeing long-term how your body's travelling. If something serious is coming up, even like cancer, celiac disease, often we'll see changes in your iron status, sometimes long before we'll find a tumour's been diagnosed. So, it's just an interesting thing that, getting your full iron studies done is a lot more of I think, a preventative health marker as much as just your iron levels and parasites as well.
This is a massive list, and all of these things could potentially lead to the fact that you've got some unwanted parasites.
Yeah,
Massive.
absolutely. And as always, like the body will express its out of balance or not well in a myriad of ways. And a lot of these symptoms will overlap for other conditions, of course, as well. But from our point of view, we always come back to the gut. How well your digestive system's working? What's your balance of good and bad bacteria like? And if you've got basically, if you're eating well and your digestive system's working well, you shouldn't have gut symptoms. So if you're getting bloating or wind or bowel variability, it means there's a problem there. Not always parasites, like it may be more food intolerances or stress or just poor digestion or FODMAPs or, a myriad of things. But, that's what we sort of specialise in as naturopaths, is helping people to work out what is the underlying contributing or driving factors.
Well, right now, by the cut, you're right, Peter, chiming in. We're still in the middle of doing the weather, mate. You just relax. It's nearly your go. 21 at Swansea Heads. Peter, we're back still talking about parasites. If we are suffering from that big list of things we mentioned earlier on, how do we go about getting to the bottom of it?
Well, getting tested is the first thing. And fortunately, even through your GP these days, you can do a complete parasite test through doing a poo sample, obviously. But it's a lot more accurate than what it used to be. So that's getting that done. If you're concerned that you might have gut parasites, is a great first line of defence.
Gee, wouldn't that be a great job going through all of that?
Yes, that would be a well-paid job, I would hope.
I would hope so.
Blood tests, things to look out for in a blood test, as I said, is, chronic low iron or iron where it's been fine for ages and then it's dropped, particularly. And getting your eosinophils, part of a normal white blood cell count, the GP will always include eosinophils. And if that's elevated, that can be another marker of parasites as well. But basically with the comprehensive stool test through the GP or through your naturopath, they need to use what's called PCR technology, which looks for DNA fragments. In the old days, they used to just sort of spread the poo apart and have a look at it and see if they could see any eggs or casings or parasites. So now they use this technology where they can test for different DNA and identify a wider, what parasites might actually be there.
That must make that job a little bit more comfortable, maybe?
A little bit easier.
Yeah.
Now, the great news, too, is that there's lots of really awesome natural medicines that can help if you feel like you do have parasites, even for kids. Herbally, herbs like wormwood, golden seal, any of the herbs that contain berberine. Black walnut hulls has traditionally been a long-standing herbal medicine, and any naturopath or herbal medicine practitioner can make up an anti-parasite mix. Colloidal silver can be a good thing to add in if someone's concerned about chronic long-term gut parasites. I would always prescribe a probiotic. A good quality probiotic containing the right strain of probiotics, pardon me, and that helps to encourage the growth of the good bacteria, changes the pH, makes the environment healthier for the good bacteria, irritating to maybe bad bacteria or parasites as well.
Once we've got to that point where you prescribe one of these remedies,
Yeah.
What sort of time frame are we talking before you'll see a change?
Well, look, it can really vary. Like generally, the orthodox treatment tends to be anti-worming treatments, which act pretty quickly, supposedly. Or if it's one of these other nastier bugs, it can be 2 to 4 weeks of pretty strong, nasty antibiotics. So with herbal medicine, I would be looking at, trialing like an anti-parasitic program. And again, the critters can be a little bit clever in that you can't just give someone the same thing for 6 weeks. You sometimes have to pulse it, where you might do 5 days of encouraging the good bacteria and improving the environment, and then do 2 to 3 days where you go in and try and knock the parasite level down.
So it's a game.
It's a little bit of an approach, and it can take 6 weeks. But ideally, if you've been diagnosed with parasites, then you'd want to retest at least in 12 weeks, just to make sure that what you've done has made a difference.
What about a digestive detox as well? Would that be something you'd recommend?
Yeah, look, it's a big thing. We recommend with a lot of our patients is let's get your whole digestive system working properly. Make sure you're digesting your food, producing the digestive acids and enzymes, that you are getting the most, that you are absorbing your nutrition. We talked a bit about iron, and that you're creating the right environment for a healthy gut flora as well. So we would usually look at a parasite cleanse as part of a whole gut heal and repair program or approach.
Or at least there are a lot of different options there. So if one doesn't work, we'll try something else. We'll keep going.
Absolutely. And herbal medicines work phenomenally for anything to do with the gut. Probiotics always, fermented foods we've talked about a lot on this show as well. So it all comes back to the same sort of whole food, whole life, wholesome sort of approach. Herbs like garlic for some people can really make a big difference with gut parasites as well. So we'll often include that in amongst while doing the herb mix, while also doing the probiotic. I'll use things like slippery elm powder in there as well if there's some irritable bowel. So again, any naturopath would sort of tailor the approach to suit the person. But, as always, I'm a big fan of, if you suspect there's a problem, try and find out if that is the problem, because anything you do to treat it obviously is going to be more successful if you're treating what you think you're treating or helping with what you think you're helping with.
Peter, as always, some great information there. Still a couple of minutes if you'd like to ask Peter a health-related question on 49216216. And Peter, we're back in a sec to find out where you're going to be buzzing around the Hunter in the next few moments. How does that sound?
Sounds good.
Health and Wellbeing at 2NURFM 103.7.